This is Ben. I'm giving you a quick tutorial on how to use QuickRes, mainly for BHP. So hopefully be able to review all the functions that you might be interested in. Let's first go to the front end to show you the front end interface. You just go to quickres.org, and when you're using QuickRes in a country that has been registered, it'll just immediately pull you to that country and in the languages that you've set for that country. You won't see other programs. So in Botswana, there will likely be two programs, and you'll have to select between the Epic project, which is currently using it, and BHP. And we can also give you some unique links to QuickRes that will allow you to skip that selection. So when you use it with your clients, they don't have to make a choice, but otherwise they would. So we can just, I'm going to select a fake country just to show you the functions. Here, clients can do a self-assessment, which is if they're not sure what services to book, they can do a self-assessment asking several questions, and it will present the client with several recommended services that are for them specifically. It reads very much like a HIV risk assessment, but the results are more focused on what services they should access, and then they can just click the service and go ahead and make the booking. It's around 10 questions that are asked in that assessment. They can start a chat, and you can program your chat to open in Facebook Messenger, Telegram, Viber, or WhatsApp. You can even add up to 4 WhatsApp chat lines and label them uniquely in case you want to talk to a client support specialist, a complaint manager, or anyone else that's relevant for the client to speak to. You can program up to 4 different chat options. And then the main function is booking services. Before we go there, there's also an About Us page, and that is going to show you the client terms of use, which would be specified for your particular program. But we do have the standard terms of use that you can use as a base and then modify from there. And back on the home page, you see that there's a note here that by using using QuickRes that you accept to these terms of use. And it's actually at the end of the booking process that there's a formal consent. They have to tick mark, and you can customize that language there. So as you start to book an appointment, you can see first option is to select what service you're primarily booking for, and you can have here your HIV self-testing. This is giving a full range of HIV services. It also has family planning, COVID-19 services, mental health, condoms. And then you can add some of your own custom services. And for your particular project, if you're doing combination testing, like self-testing that includes maybe HIV plus a couple STIs, I'm not sure the exact technology that you would use, but we can add that for you onto QuickRes. We'd have to custom add a new service. But this is an option, HIV self-testing. The next is to select the modality of how they want to receive the service. So for self-testing, you would be able to receive it in person or via delivery. You can't get a self-test like virtually. You actually need the real commodity. So in real life, this wouldn't show. But the virtual is an option if you want to book an appointment for a consult. So we can go ahead and say delivery. And you can set your providers to offer it from certain locations. Like we want to deliver from our office in Habarone or our office in another location. So you can segment the providers by location. And then clients will be able to select the provider from where the service will be delivered. That's this step. And if it was booked for in person, then you're booking with the provider to see them at their specific address. And you see some information here. Like the name, the location, maybe the icon of the provider, or even an image of the provider or of the hospital, their location, services offered, and you can continue. Here is the next step to select the service, the time for when the item should be delivered. If it's an in-person appointment, then it should be the time of when the client should arrive at the service provider. And you have all these options. You can also customize your time slots for each provider on the system to say 1 appointment per hour or 1 appointment every 15 minutes. And that's what you see here, every 15 minutes how it has this time slot. And the client will continue. This is the final page where the client is going to enter their name or nickname, their phone number where they can be called to confirm their appointment or to confirm their request for a delivered service. They can even add their WhatsApp. They can specify um, their contact preferences, communication preferences, and some questions here for demographic details of the client, date of birth, sex of birth, gender today. We can add a question here. It's turned off for this particular program, but there's another question that allows you to disag by key population if you're interested in that. And back up at the top, just so you see, it's confirming the appointment details, the date, the time, the provider, it's by delivery. It does ask the client to specify where should we deliver the service, so that this information, the location information of the client, will be shown to the service provider at this clinic, so they can see that the client wants it delivered here, and the client can put an address or specify a certain place where they will be. And the last step is just to put in this code, confirm they're human, understand and accept the terms of use policy, and then they submit. So that's the process for clients for requesting or booking services in any modality. And then let's take a look at the back end, give you a quick run through here. So you log in, and when you log in as a program user, like I'm showing you from my administrator view so I can see all these programs that are available using QuickRes. Let's go to our test program. So you can see here, these are all the clinics that are registered. And you go to the reservations view. So you can manage this as clinic level staff that receive appointments. You see some appointments here. Dak Matar booked for the 7th of March, which is in a few days. And you can go back in time to view older appointments. Essentially, providers will be able to log in. When they log in with their provider login, they're going to immediately come here and see appointments that are only for their clinic, so that they're not distracted by appointments booked at other places. They can't even see those. They're just seeing those here. And they'll be able to see the appointment. They'll be able to see if the appointment is booked as a delivery here. It'll actually have a little a van or a bus emoji that denotes it's for delivery. And when they click on this option, it would say delivery, and it would actually have the details of the location that the client put on the front end. It will show up here. So a typical process would be that the provider looks at this phone number, calls the client, mentions that they saw the request for a delivered service, and then they go in and make sure that the location is accurate. They update it, save it. They actually deliver the commodity to the client, and then they go ahead. As an example, I'm adding a service here because this is not the same record that I showed you on the front end. I'm adding the HIV self-test option, and now I say that I've delivered it, so it's been unassisted, and we do not have a test report, no result reported yet, so it's still unreported, but it's unassisted delivery of the kit. Save. You see here it's pending, which means that the result is still pending. And yeah, so then the next step is to get the result from the client, and this could be optional. So one option is that you have staff that call the client, say, hi, hey, how did it go? Can I help you with your next steps? They might learn about the result. They can go ahead and report non-reactive, reactive, or invalid here, and they can save. I'm not going to save that. There's another new option where clients can self-report their result, and I'll show you how that works. I'm going to do something really quickly. So the way it works is that you can turn on a function for your program where any client who has HIV self-test kit distributed, either it's assisted peer-mediated, or unassisted. If you select any of those, the system will send an SMS to that client and say, thank you for booking your self-test kit. Feel free to report your results securely on QuickRes, and it'll add a link, and that link will take them to a page. I'll show you what it'll look like. So the client will get a link, and it'll bring them here, they won't need to select a country. It'll automatically know the country because it'll be programmed into the link that is sent to them. They also won't need to find their kit. Like right now, because I'm sort of I forced it to go to self-report. It's asking me to find the associated kit. So if I report the result, it needs to know which kit to assign that result to in the system. So clients will not need to do this either, because if they get that link in their SMS, the link will include a portion that has this reservation code embedded. So actually what clients will have is a link, they click it, and it goes right to, hopefully this works, to this page. And it'll just say, we found your record, you access a self-test kit from this clinic on this date, which should match what we shown here. And it is, yes, at 123 Town Clinic at 8 a.m. on the 7th, and that's exactly the one we're looking for. And clients can simply, put in their result, not reactive, reactive, or invalid. And let's give an example, saying reactive, submit. So because they chose reactive, they do have, a little recommendation for accessing standard HIV testing to confirm the result, book your appointment, or contact us here. I believe this takes them back to the homepage where they can book those services. But at the same time, once they finished here, their result gets added on their record. So whoever supported them to deliver the kit will be able to see that, so they can provide follow-up. I'm going to refresh the page so you can see what that looks like. You see now this same record has HIV self-test green. It's been reported. And you also see the HIV testing button turn yellow, which means that it's recommended to offer that to this client. And so the provider can log in and say, okay, HIV self-test, and it says reactive, and it gives this note. This entry was entered on the self-test reporting portal, self-reporting portal. So it means that the client reported this. And all this information is stored in an Excel document, which you can download. I'll show you here, export data. This is where you can download all reservation information, so all appointments and all services delivered against those appointments, and even some more complex, useful information that could be helpful for you. When you download the data, you can select that you don't need to download the COVID information or the postnatal care. These are maybe not be relevant for you. You're not doing those services, so you can remove those. And then you can download some additional data exports in the same file. If you're using client referrals, you can add that. Client traffic log, which is the number of hits on the website, how much traffic you're getting. If you are collecting client feedback on QuickRes, you can download their feedback here, and then there's also SMS. You can clean the data, which is going to clean records that are used for testing purposes, and then export the data into Excel. The resulting Excel will have all of your data for service delivery and of reservations made, and you'll be able to use that to analyze the percent of appointments that are arriving, the case finding from your self-testing, if those clients were linked to additional services. In the data export, it does encrypt the client's phone number, so you can't use the data export file to call clients back because the phone number is not shown. Just for data security purposes, the only way to support clients individually is to use the reservations view, like you saw when I was on the clinic view, is that's how you can see their phone number and provide support to clients. This is just used for data analysis. As another example, let me just show you some of the automated data visualizations that are available. We can go to the cascade view. This is showing overall appointments in the system and the modality of the appointments, delivery, virtual, in person, the percent of all of those that are arrived, meaning the client successfully got in for that service, or was delivered that service, arrived, and you have missed the arrival percentage, and then you have additional service delivery information. Among all these appointments that arrived, self-test and test results here together. You have case finding shown separately for HIV testing versus self-testing. You have some additional information about ART initiation, prep initiation. Yeah. You also have a timeline view, which you can customize. Let's give a real country as an example. Philippines is a good one. So Philippines here is showing first column overall appointments on the system, appointments for any type of service, and it's showing you the arrival rate of those appointments. So you have total appointments 1,600. Those arrived here is in blue below, and then canceled in black, and gray is missed. In the secondary column is now showing self-testing. So if your main program component is self-testing, you'd see the self-testing results be a lot closer to the overall arrival. But in this program, they're not using self-testing for every client. It's just a small component. So you can change it here. Let's go to just normal HIV testing, and the results should be a little bit higher. So you can customize your second variable to show the testing and the results in the same bar. And below each bar, you have the category of results. So pending results, HIV negative, HIV positive. And then you have the categories of the first bar: future appointments, missed appointments, canceled, and arrived. And that second bar you can customize, like I showed: self-testing, testing, STI testing, viral load, provision of ART or PrEP, or clients added to a cohort. So if you do any long-term cohort management, you can track those that you enroll into a cohort here as well. I haven't shown the functions for case management. I'm not sure if that'll be a function for you, but certainly it's on here, and we're using that in several countries. So something to note. I can do a second video on that. And I'll do a quick view of the case manager view. It gives a different view of reservations. This is real clients. So let me go to the test QuickRes country. And you can see here, each appointment can be assigned to a certain case manager. So when they're logging in, they won't need to select their name, but they would only see those assigned to them. And as an administrator, you can see appointments assigned to anyone, and then you can filter by those assigned to a certain case manager. And case managers can do a lot of things here. They can filter their appointments by those that are incomplete and need to be confirmed, look at any missed appointments that should be rescheduled, filter the appointments to only show those that have like a pending result, like HIV self-test pending, so they can just focus on those. You can also filter to view only appointments that have a complaint reported, so that you can go in and resolve the complaint. And then you have the cohort filters, anyone added to the ART cohort or PrEP cohort, and be able to do some follow-up and tracking there. Those are some of the main functions. There are several others. I mean, one of the big value of using QuickRes is that you can easily add new clinics. You can just go here, create a new clinic, or you can edit your existing clinics here by changing, lots of things. Our working hours, which allow the system to show appointment slots when the provider's open, add holidays when the provider will be closed, add contact information. You can also here denote for this provider what services are offered, HIV self-testing, and in what modalities they're offered. So that on the front end it's shown. You can even add a cost for certain services so clients know if they have to pay a fee for anything. And yeah. Last, I'll just note that the system automatically sends SMS reminders to clients to prepare them for their upcoming appointments that are booked. You can edit all of the SMS message content to be customized to your program here in the program settings, and you can customize the front end translation of the website. Right here it has English and Urdu, but your program can have any two front end languages that you like, maximum of 2 currently. And yeah, that's a review of QuickRes, and I hope that's useful. Let me just see if there's anything else here. In terms of reporting, you saw HIV self-test. This is what the test standard testing looks like: negative, positive, or pending result. Add some notes about the result here. We have some other functions as well: non-communicable diseases, which we just added, diabetes, hypertension, cervical cancer screening, and you have all these options here. Co-infections, which include STIs, is available. And I'll show you what that looks like. STI generally, screening results, hepatitis, Hep B, tuberculosis, pneumonia, meningitis. You can report uniquely any screening results and treatment offered. And if you need this to be more specific, like for a specific STI, we could build that out with you. And yeah, that's the review. Of course, you can also manage collection of client feedback here, sending a client the survey via SMS or opening the survey here on the screen to complete the survey with the client. And you can manage client referral to clients who test positive. If you want to offer to them, hey, do you want to refer any other people in your network, maybe sexual partners or friends? You can do that here, where the provider can go ahead and enter the phone number of each person they want referred, or you can send it to the client for them to go to that link and refer their friends. And yeah, that's the end of this little tutorial. If you want anything else visualized or demoed, let us know.